So we have major surgery within 4 weeks, well, surgery was 3 days ago, malignancy or leg swelling, which indicates high probability of DVT. So well score is something to read up on. It's more important for step 2. For now, just know what it is and know what we use it for, okay? So it's a DVT, yeah. So guys, what do we have to, what answer do we have? Well, we have D-dimer, that's pretty good. TTE, well, that's echo, that's going to be out. CT palm, well, we use that for what, guys? For pulmonary embolisms, right? So we use that for PEs. That's a test of choice for pulmonary embolism. So this wouldn't be helpful in diagnosing a patient with DVT. This CT palm angio is for pulmonary embolism, right? So this is out. Now we have blood cultures. Well, that's important. But I mean, why would you use a blood culture? Any idea, guys? Blood culture? That's why I would rather explain the fever. But DVT comes to mind, but would that explain the fever? Yeah, so there is fever with DVTs. Sure, there's a fever with DVT. But being that there's a fever here, we start thinking, maybe there's infection, right? But would blood cultures be helpful in establishing the diagnosis of DVT? No, because a blood culture is useful for diagnosing in a case of cellulitis, right? So clearly there's an infection, but at the same time, when you have a DVT, yes, there's pain. Obviously there's issues with there's surgical pain. Like when that person has surgery, usually that's a good sign of having some sort of a DVT. A lot of times they're in bed for a long time, mobility, which then leads to a PE. So this is where you have to be careful, ladies and gentlemen, because if you have a fever like here, some people might say, you know what, blood cultures. No, I understand that, but blood cultures are usually ordered to see if there's an infection. Even though there's a fever, right? We know it's a DVT. Be careful, because usually we know it's a DVT in our minds. We see high temp. We think maybe there's some sort of blood infection. There we go. But then you would see more things with cellulitis or blood infection more than what they're presenting here. So that's why I will also say that wouldn't you see erythema? Yes, I would see some erythema, maybe some rash and cellulitis. In this case, there is no erythema and no rash. So this is where we have to be very careful. The words they choose in the question stem helps us and dictates how we diagnose and how we dissect the question. So clearly, if you're very, very under the gun and you're very fast, you might say, well, there's a fever here, must be infection, blood cultures. Yeah, but blood cultures are for cellulitis, and also you would see some erythema or rash. You do not see that here. So this is out. Now you always have to remember, know the diagnosis and move on from there. So it's DVT, ladies and gentlemen. Look at the answers. D-dimer compression ultrasound. Which of the following is most likely to be helpful in establishing the diagnosis? What do you guys think? A looks good and E looks good. They both look good. They both look awesome, right? One looks better than the other. So you say to yourself, well, I want to choose D-dimer because D-dimers are used to rule out DVTs. They're used to rule out. Yes. Unfortunately, you have to remember that if a person has a recent surgery, it's going to be a false positive, right?